Should you get assessed for ADHD if you have borderline personality disorder? Welcome to the What's Eating You podcast. I'm your host, Stephanie, and I'm a psychologist, published author, and public speaker here to educate and validate. Enjoy the show. Welcome back. My name is Steph, and I'm a clinical psychologist here to break it down. If this is your first time on the What's Eating You podcast, welcome. And if you are a regular, welcome back. I am so happy you decided to be here today. And of all the places you could have been, thank you for tuning in. I appreciate you and I am grateful for you. As always, before we get into today's question, I recommend that you hit that follow button, subscribe, and always be in the loop for upcoming episodes. Today's episode comes from a listener who has submitted a question. She has said, "Hi Steph, long-time follower, first-time messenger." Absolutely love that. I love just to know that people are listening behind the scenes, because usually you feel like you're just talking to a brick wall and you don't really know if anyone's hearing it. So it's really nice to know if you are a silent watcher or you have been shooting me for some time. Let me know. Always just let me know if something resonated with you or you enjoyed some content. I love to hear it. The rest of the message goes like this. I've recently done an ADHD assessment with my psychologist after years of thinking I may have it, and have been told that I should see a psychiatrist to get a diagnosis. I was also diagnosed with borderline personality disorder last year, and I'm worried that with the similar symptoms between the two, that it could be a waste of money. And I also have people like my mom telling me, what's the point if you have lived with it for so long already? Interesting comment. I just need a bit of advice, as I've been listening to your podcast to try help me, but I thought I'd take my shot and shoot a message and ask you personally for your opinion, as I don't see my psych for a couple of weeks. Thanks and love your work on the podcast. Well, thank you so much for your message. There is so much here to unpack, but I just want to reiterate, disclaimer, this is not psychological advice and it's not therapy. Always seek your individual professional, but I am going to go through what I think and go through the literature and give you lots of good things to consider. First of all, we're going to break down what these disorders are. What is ADHD? What is BPD? How common they are? When you should get assessed for it or whether you should, and the process of getting assessed. We're also going to cover things such as why a lot of psychologists won't assess you for BPD and break down the stigma behind it. Let's begin. This girl was diagnosed with BPD 1 year ago, and now she's considering whether she has ADHD. ADHD is an attention deficit hyperactivity disorder. It's neurodevelopmental, which means it affects your brain. It typically manifests in childhood, although many women are getting diagnosed now and later on in life because the signs and symptoms were not picked up when they were young. So essentially, you are born with it. That is the literature that's out at the moment, but it's a persistent pattern of difficulty with maintaining your focus, and you may also be hyperactive and impulsive. The inattentive symptoms can include difficulty sustaining attention in tasks, frequent careless mistakes in your schoolwork or your work, not being able to sustain your attention. So someone's talking to you, they might say you're dazing off or you're not interested. You have difficulty organizing tasks, and you avoid or dislike tasks that require sustained mental effort. So this is where procrastination comes into it, and avoidance, because you really don't want to do the things you don't want to do. There are 3 types. So there's the inattentive subtype only, and that's those symptoms I spoke about. And then there's a hyperactive impulsive subtype, which is fidgeting, tapping, squirming in your seat, inability to stay seated in situations where you're expected to stay seated, running or climbing. This is more about children, but for adults, it can be mental restlessness, often on the go, you're driven by a motor, you interrupt others, you might be described as a chatterbox, you might intrude on others, you butt into conversations, speak when it's not your turn, cut people off. Now, ADHD needs to occur in more than one setting, and it needs to affect your life on a day-to-day basis. There are other symptoms such as emotional dysregulation, struggling to manage your emotions, but this isn't really emphasized a lot because it is difficult to quantify. And this is why many people with ADHD don't get diagnosed till later on in life, because A, women mask, or B, they don't realize how much they struggle until they have children or the life demands get greater than their coping abilities. So that's ADHD. And how many people have it? 1 in 20 people. That is a huge statistic, but only 1 in 10 are getting assessed and diagnosed for it and properly getting that support, right? So that's 1.2 million Australians. And if you're not from Australia and you listen to this podcast, let me know, because I will include global statistics. I just include Australian statistics because I know a lot of Aussies listen to my podcast. But if you're from another country, let me know. Now, BPD, dun, 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 borderline personality disorder, is less common, but still significant. So it affects 1 to 2% of the population, which translates to tens and thousands of Australians. What is it? Borderline personality disorder, or BPD for short, it's an enduring mental health condition, and it usually comes up in adulthood. Because your personality is still forming, they are very unlikely to diagnose this before you are 18. They might say you have BPD traits or traits of BPD, but essentially it's characterized by an instability in your moods, in your behavior, in your self-image, so how you see yourself, your identity, and your functioning. Now, these problems result in relationships that are often turbulent and problematic. So the way I describe BPD is there's 4 areas of dysfunction. So one is emotional instability. So your moods are up and down. And unlike bipolar or mood disorders, the moods don't just change every couple of weeks. This can be in a matter of minutes or days, and it's really intense. When I did my training on BPD and dialectical behavior therapy, there was a great term used to describe BPD as emotional burn victims. So they feel emotions so intently, and these emotional episodes can be anger, depression, anxiety, and this can last a few hours to a few days. And the other thing they feel is chronic feelings of emptiness. That's the first part, is the emotional instability. The second thing is interpersonal difficulties, and this is the key. For any personality disorder, there is always going to be interpersonal turbulence or challenge. And this is because people with BPD tend to engage in something we call splitting, which is idealizing someone, putting someone on a pedestal, having a favorite person, and then devaluing them if they do something wrong, because they struggle to see that good and bad qualities can exist in the same person, because people with BPD have this very black and white style of thinking. Either it's really good or it's really bad. The other reason they have difficulty with interpersonal relationships is because of this frantic effort to avoid real or imagined abandonment. People with BPD really struggle with rejection sensitivity, and so they're with ADHD, and they also fear abandonment, which people with ADHD may not fear, but I'll go into that more. So to avoid abandonment, they might engage in some risky behaviors or overdoing it in relationships and may be perceived as needy or super anxious or super clingy or whatever it may be. And because of this, people may abandon them, or people may give up on them because they cannot handle the mood swings. Number 3, the area of dysfunction is their behavior. So because people with BPD are often impulsive, which is why it looks like ADHD, they engage in acts that are self-damaging, such as spending sprees, unsafe sex, substance abuse, reckless driving, and binge eating. Why does this happen? Because again, the person with BPD has such extreme moods. They go from 0 to 100. They don't know how to manage it. They haven't been taught usually effective ways to deal with their emotions. So the way they deal with those emotions are extreme and not often very helpful. Number 4 is the distorted self-image. So often people with BPD, they don't know who they are. They will often change their hair color, get piercings, change the way they look, change jobs, change what they're doing. And this is obviously my observation because I have worked with people with borderline personality disorder, because usually when they were growing up, it wasn't safe to explore. They were in a really turbulent environment, or being at home, they had to be parentified, they were looking after their parent, and they didn't have time to play and explore in a way that felt safe to really understand who they were. Or they were trying to people please and get the approval of someone or their parents, that they developed this kind of chameleon personality to make other people happy. Again, I'm speaking on my experience. This may not fit the box of everyone with BPD, but my qualification to speak on it comes from the fact that I am trained in dialectical behavior therapy. I also was an individual psychologist back in the day for a program for people with BPD. It was a 9-month group and individual program. So I have worked in programs and I have had BPD clients as well. And the last important thing I'll add with BPD is that there is usually recurrent self-harm or suicidal behavior, gestures, threats, or self-mutilating behavior, which people with ADHD often don't have. You don't see people with ADHD be suicidal. They might be, but not as chronically and intently as someone with borderline personality disorder. BPD negatively affects someone's life. They have trouble with work. They have trouble in their social life, with their friends, with their family, and maintaining a relationship. So that's what the two disorders are. Now, the person who submitted the question may have been diagnosed with BPD, and I just wanted to give a shout out. Amazing you're in therapy, amazing you're speaking about this, but now she's considering whether she has ADHD. Considering your psychologist has flagged it and thinks that it could be ADHD, and you're thinking of getting assessed, that's really responsible. That's awesome. But your psychologist wouldn't flag it if she thought it would be a waste of your time. Usually psychologists will flag it or will run a screening assessment to see whether you have the symptoms, and if they think it's clinically appropriate, refer you for a full assessment. Now, you may be wondering, why doesn't this psychologist just assess her herself? A couple of reasons. If you have had an ongoing therapeutic relationship with someone and already given them another diagnosis, it may not be clinically appropriate or ethical to do the assessment with that person, because you could have a biased point of view. You're not coming in from this clean slate. I'm not saying that this doesn't ever happen. It is okay for a psychologist to assess someone they've been doing therapy with if there's that open communication. The other reason could be that this psychologist isn't trained in assessing ADHD. And the third reason is that this psychologist is already doing therapy, this client is engaged in therapy, and she probably needs medication management for the ADHD symptoms, and the quickest way to get that and the most efficient, given her circumstance, will probably be to go directly to a psychiatrist for that. On to the next question. The next question is whether it is a waste of her time to go get assessed for this. I don't think it is. If the psychologist has already flagged it, then there's definitely a need to go get this assessed and to get it checked out. But the question, is it useful? Her mum said, you've lived with it your whole life. Is there a point actually getting diagnosed with it? And this is usually what a mother of someone with BPD would say. Not that that's very appropriate for me to jump to that conclusion, but it ties into what I'm about to talk about, which is how people get BPD or ADHD, right? Usually it develops as a result of genetic and temperamental vulnerabilities combined with childhood stressors. So in borderline personality disorder, I have never met someone who has BPD who did not grow up in an invalidating environment, which means basically their childhood needs were not met by their primary caregiver. In conjunction with that, there might be a family vulnerability. If someone in the family had BPD, there is genetic vulnerabilities, and also temperament. So if you were an angry child or you had a difficult temperament, this combined with the other risk factors can make you more vulnerable to developing BPD. So what happens is, if your childhood needs are not getting met, if you're not getting those basic needs of feeling safe, feeling secure, getting affection, getting attention, getting safety, you essentially don't learn to regulate your nervous system. You essentially don't feel safe to explore, to be who you are. And that affects your development, and that affects the development of your personality. You develop a personality in response to these stresses, and that personality is usually someone who's hypervigilant, has trust issues, may dissociate, disconnect with reality, and constantly feel like they're not good enough and empty. Now, similarly, these risk factors for BPD can also occur with ADHD. If you are even in the womb, when your mom is pregnant with you and she has stress and she has ADHD, or she's drinking or having alcohol or substances, that puts you at risk of developing ADHD. Basically, the brain in ADHD does not develop typically, and there are things responsible for this, many different reasons. But growing up in a trauma-filled environment doesn't help with that, right? So trauma does essentially increase the vulnerability of having these diagnoses, right? ADHD and BPD have a genetic component, although the hereditary aspect of ADHD is stronger. So when parents have ADHD, home life is more likely to be inconsistent, chaotic, emotionally volatile, especially if your parents have undiagnosed ADHD, and intense emotional responses may have been labeled as unacceptable or overreactive because parents found their children hard to tolerate. The parents had ADHD themselves, couldn't tolerate their kids, so they would say, "You're overreacting, what's wrong with you?" Da-da-da. Never taught them to self-regulate their emotions. And it seems that a history of childhood ADHD may increase the risk for developing BPD. And that will increase the severity of the BPD symptoms. So, in those with histories of early trauma, co-occurrence of the two disorders results in greater impulsivity and emotion dysregulation. So, just remember that there is a high likelihood that these can occur together. I remember a statistic saying 40% of people with BPD have ADHD. The main reason is they grow up in similar environments, okay? And what we know about trauma and these two disorders is that childhood neglect and abuse increases the risk of developing a range of disorders. In fact, studies have found that women with ADHD and BPD often have traumatic early histories. It is likely that early childhood trauma can exacerbate ADHD symptoms and contribute to the development of BPD. So if you're struggling with focus and concentration as a child and you're told there's something wrong with you and you're told you're not good enough and why can't you concentrate and you're always overreacting, then your personality is going to suffer. You're constantly going to walk on eggshells. You're going to be people-pleasing. You're going to just want to not get in trouble, and that shapes you truly experiencing who you are and this personality that you are developing as a growing child, a growing adolescent. What was really interesting was that ADHD histories are more strongly associated with neglect and physical and emotional abuse, while BPD histories are more likely to involve emotional and sexual abuse. So if you've had all of these, then yes, your likelihood of having both is high, right? Now, if we really want to go into the trauma field, don't forget that at least a quarter of these women with borderline personality disorder will also have post-traumatic stress disorder. So it's important to get this ruled out or considered because sometimes symptoms of PTSD can look like ADHD as well. The main difference is PTSD forms after one traumatic episode, whereas ADHD, it's lifelong. You have to be able to prove that your focus and your attention came from a young age and it was persistent despite different interventions that were tried to use. Now, how do you actually get assessed for both of these? Where should you start? I think that this person is in a good position because they're already supported by a psychologist and they already have a diagnosis for BPD. Straight off the bat, you know that their likelihood is strong of having ADHD. There's that 40% likelihood if she's doing therapy and then still is struggling with concentration and focus, and this has been going on since childhood, and if a psychologist has flagged it, I would definitely say these are all green flags to go get assessed by a psychiatrist. Now, getting assessed for ADHD is more straightforward than getting assessed for borderline personality disorder. The first thing you want to do is make sure that the person you're seeing has the ability to assess you, because not every psychologist and psychiatrist will assess for these conditions, especially BPD. More psychologists are learning to assess for ADHD, but again, if you want medication, you do need to be referred to a psychiatrist for that either way. And I'll do another episode on who you should go to and why. But essentially, an ADHD assessment has 4 parts. You have your initial consultation where you talk about family history, any medical history, mental health history, your concerns and your symptoms and how it affects your daily life. Session 2 is usually a symptom checklist and questionnaire. A session with a psychologist may go for a little bit longer because they might be trying to rule out other things or talk about other issues. Then there's number 3, which is getting collateral data. Not everyone does this. We do it, but we do get information from a close family member or someone who knows you really well. We just want to make sure we're across the board and that the people who know you well have also seen you struggle with this. For behavioural observations, this is called the MSE, the mental status exam. So actually in your session with us, we are looking and picking up on things, right? So I'll give you an example. People with ADHD, where's the Zoom link? I didn't charge my laptop. I see half their face. They're on their phone. Their camera's not set up. They forget the appointment time. Or they're the opposite. They're hyper-organised because they don't want to stuff up. They ask them to repeat the questions. They go off tangents when I ask questions. They answer a very straightforward question in a very roundabout way, and I usually have to contain them and bring them back. And obviously with ADHD, there's different levels and severities, but these are just some of the behavioural patterns that I notice in ADHD assessments that you have to flag and point out. And then the last part is additional cognitive and psychological testing. So using evidence-based psychological tests that look at memory, attention, problem-solving skills, and we might actually do some questionnaires on their mental health as well, depression, anxiety, and stress. And then after all that, we'll go through the DSM-5, which is the Diagnostic and Statistical Manual of Mental Health Disorders, which is the Bible that we use to diagnose, and make sure that they actually meet the clinical criteria. And then if you want medication, you can go straight to a psychiatrist, but a psychiatrist will go through this similar pattern as well. Whoever you see, make sure they have the expertise to assess this. BPD, on the other hand, I'm not going to lie, it's another bag. So the fact that this person who sent a question already has a BPD diagnosis is a good thing, because that's the hard one that you get out of the way. So who can assess a borderline personality disorder diagnosis? Can be done by a psychologist or a psychiatrist, but not a lot of psychologists do it. And there's reasons. There's a reluctance, and I'm going to speak out about this. Many psychologists are reluctant to diagnose or assess for BPD, and there are several reasons. The first reason is stigma and misunderstanding. BPD is surrounded by stigma because it's got this rap that it's difficult to treat, that clients can be challenging, and all this other stuff. But I don't think that's the client's fault. I think that's essentially society's fault and our fault. If we learned how to deal with this better in our training, if we actually focus on early intervention, then we wouldn't be here. And research shows when people get an early diagnosis of BPD and they get early intervention, their symptoms are actually better and they are much better off. So yeah, that's why they're hesitant to diagnose it, but not diagnosing it may be increasing the difficulties of managing it, which increases the stigma, which increases the complexity of it. And the second reason psychologists are reluctant to diagnose it is that BPD is complex. You can't just assess it in one session. You have to be able to prove that it's not other disorders, that it's not ADHD, it's not depression, it's not anxiety, it's not bipolar. There's a lot of symptom overlap and it's challenging to diagnose. That's another one. The third one is fear of labeling. Psychologists are cautious about diagnosing BPD because a lot of people don't want to be labeled. getting a personality disorder diagnosis can lead to feelings of being misunderstood or judged, which can affect the therapeutic relationship and the perception. And the last reason is treatment challenges. Yeah, so BPD can be challenging to treat and manage because of the intensity, the risk of self-harm, suicidal ideation. And I'm speaking on the worst severity. I'm not talking about people with BPD who are self-aware and managed and they're doing well. This is your worst case criteria. There is one more reason I'll point out. And look, I don't know if BPD is going to be a diagnosis forever. I might do another episode on whether we should abandon the diagnosis, because I've been reading articles about this, particularly in the US, where they're discussing it. Because according to the DSM-5, the Diagnostic and Statistical Manual, a diagnosis of a personality disorder requires that the person must have criteria A, an enduring pattern of inner experience and behavior that deviates markedly from the expectations of the individual's culture. What the hell does that even mean? What does that even mean? And criteria B, the enduring pattern is inflexible and pervasive across a broad range of personal and social situations. So basically, what these are saying is that a valid diagnosis requires the diagnostician to sample behavior in a broad range of settings. Now, most clinicians, they only see their client in the therapeutic space, in the office, which doesn't meet the criteria of a broad range of situations. It's just going by what they're told. And an office and a therapeutic setting, it's not even a typical setting. So the only way to sample behavior outside the office is to interview other people or people who know your client, which poses a whole other myriad of concerns. And this is only really done consistently in forensic settings. Yeah, the criteria makes a diagnosis of any personality disorder challenging unless you've worked with them for a super long time and you know what's happening, or they've been to hospital, etc. So this is the issue I have with this. The major consequence of clinicians avoiding a diagnosis of BPD is that the symptoms don't get addressed, right? So they might diagnose anxiety and depression and PTSD, and that becomes the focus of treatment, right? And for people with BPD, this might make their condition worse. So that's the sort of long-ended version of borderline personality disorder, why it doesn't get assessed, why it's often, stigmatized, etc. You think this should change? Let me know. But back to the question at hand. Okay, so the comment from the mum, you've lived with this for so long, what's the point getting assessed? Yeah, okay, that might be a good reason, but for many people, getting a diagnosis, getting an ADHD diagnosis, even after a BPD diagnosis, can be crucial for several reasons. A comprehensive assessment is literally the treatment for many people. Knowing that you are the way you are because you had ADHD, not because you were stupid, not because you were dumb, not because you were not good enough, that you actually had a brain condition that made you different, is very healing for many people. I don't know why I'm yelling. I just get really passionate about this because often the people who are saying, what's the point getting diagnosed, or don't go on medication, are often people who don't have it, and are often people who haven't seen the pain that that person has gone through, and are often the people who are the reason that this person is in this problem in the first place. Not saying that this young person who's messaged me is in this position, but there, I let it out. Secondly, having a clear diagnosis can help you develop strategies that target the symptom. So for example, while both ADHD and BPD can have impulsivity, the underlying causes and the best strategies to measure it might differ. So for example, if you're impulsive because you're stressed, is that linked to ADHD? Is it linked to BPD? Are you getting enough sleep? What is happening? It's important to consider peace of mind that might come with understanding yourself better. I would like to know, what is the cost of not knowing for this person? What is the cost of going through your life not knowing you have ADHD to explain your symptoms? And even if you went in to see the psychiatrist, they did an assessment and they're like, really sorry, you don't have ADHD. What is so bad about that? I highly doubt that would happen in this case because her psych has already assessed for it. It sounds like it's just a confirmation diagnosis for medication purposes. But again, whilst your mum's point of view may be valid that you've lived with it, what if your life could be easier and better and your quality of life could be better? It's not just about surviving. We want to thrive. We want life to be more manageable and more fulfilling. So remember, this journey is about you and your well-being. Try not to let anyone else tell you what to do or how to manage your mental health. So I encourage you to have an open conversation with your psychologist about these concerns at your next appointment, and they can provide a more personalized approach and help navigate your concerns. But I do really appreciate this person reaching out. I appreciate their question. I'm sure many, many people can relate to this. And if you enjoyed this episode, please let me know. It's been great to be back in the podcast hot seat. I did take a big break, but we are back, baby. We are back. Take a screenshot, leave a review, let me know you enjoyed it, and I will see you in the next episode. Oh, and P.S. if you're listening to this thinking, oh my gosh, I really need to get an ADHD assessment, I have an online clinic that assesses for ADHD. There are no wait times. We are qualified psychologists, so click the link below, get in touch, and we can help you with your concerns. Have a great day, and I'll see you next time. Thank you for listening to today's episode. I am truly grateful for you being here. If you got something out of today's show, please take a moment to leave a rating or review. To access more resources or support, check out the show notes below. See you next time.